Emergency Care Scenario 1. Cecilia, a 37-year-old G3P3 woman who is here for her IUD insertion because she no longer wants kids. After getting up on the table, she starts to have left side chest pains, and she rates the pain 5 out of 10. The pain radiates into her left arm and feels like pressure. She is somewhat panicky and has no tingling in her fingers or around her mouth. She feels mildly nauseated. She developed mild shortness of breath after about 10 minutes of chest pains. She slightly gets dizzy after a few minutes. Miss Cecilia has high blood pressure, high cholesterol, and smokes 1.5 packs a day. She is mildly abused and has a sedentary lifestyle. She is not diabetic, but her father died of a heart attack at the age of 50. Her medications do include blood pressure medication. The question for the scenario today is you have just brought this client, Cecilia, into the exam room and are setting up the room for an IUD insertion. You notice that the client starts to feel uncomfortable because she is having chest pains. Describe all the steps that you would take to appropriately assess and examine this patient's condition. First you'll put Miss Cecilia in semi-paralysis position. Then you'll ask her on a scale of 1 to 10, 1 being the lowest, 10 being the greatest, how much she's in pain. Then you'll perform and document vital signs, including the pain assessment. Then you'll immediately inform senior staff and a doctor. Then you'll perform a 12-lead EKG and once the EKG is performed, you'll have a medical officer check it and then ensure that you have easy access to a defibrillator